Hi guys, welcome back to Code Master Coach, your medical coding tutor. Okay guys, as promised, I'm going to continue my review of the CPT classification. Put together a little PowerPoint presentation. I want to share it with you. Okay, we are talking about modifiers. Modifiers are a 2-character modifier code that's appended to a 5-digit CPT code to report additional information about any unusual circumstances under which a procedure is performed. These modifiers support the medical necessity of procedures that might not otherwise qualify for reimbursement. HCPCS, Healthcare Common Procedure Coding System, has tons of modifiers identified on the inside cover of their book. Most 2-character modifiers are numerical. However, there are some alphanumeric modifiers to indicate the physical status of the patient undergoing anesthesia, whether they're normal, whether they're older, whether they're under 1 year old, etc. These are the P modifiers, and we'll be discussing these further when we get to the anesthesia section of CPT. Alphabetic modifiers may also be used. For example, RT for right and LT for left. But these modifiers indicate that a particular event modified the service or procedure, but there is no change to the definition of the code. For example, an appendectomy is a removal of the appendix, right? Let's compare an appendectomy for a 200-pound patient versus a 900-pound patient. The 200-pound patient is average, but a 900-pound patient will require more time, resources, anesthesia, etc. Just think about all of the resources that will be needed in order to do an appendectomy between the two patients, 200-pound and a 900-pound patient. So in a case like this, we would attach modifier 22 to indicate that this was an increased procedural service and that the additional resources are needed so that we can get the third-party payer to give us a little more reimbursement for the more resources that were used. A procedure performed bilaterally, for example, may be indicated with modifier 50. It was done on both the right and the left. So review modifiers on the cover of your CPT book, as well as study Appendix A that's at the back of the CPT book. They both identify the modifiers. Appendix A describes the modifiers in detail. HCPCS modifiers identify a specific finger or toe. Okay. Some third-party payers may have their own policies for reporting modifiers. So again, there's more rules to have to learn. For example, I can remember several years back when I was doing billing, Blue Cross Blue Shield did not accept a modifier 50 for bilateral procedures, and they wanted modifiers RT and LT instead. So third-party payers play a key role in which modifiers should be used. Notice modifier 25 is limited to only the evaluation and management section of CPT, where modifier 78 is limited to only a surgical CPT code. So spend this week reviewing CPT modifiers and look at them not only on the inside cover of your CPT book, but research them further in Appendix A, as it gives an in-depth description of each modifier. I always tell my students, if you don't know a modifier exists, you won't know to use it. If you don't know that a modifier exists, you won't know to use it. So that's why it's so important to know these modifiers. We will be discussing additional modifiers in the anesthesia section of CPT, as well as HCPCS. All right, guys, thanks. I'll see you in the next one.